Neck pain, often associated, neck pain is pretty much the same thing as the lower back pain. Pretty much. The only difference, smaller vertebra and the facet that I told you, the ones that hold above, one is flatter than the other. One is like this, the other one is like that. That's it. That's the difference between them. But neck pain associated sometimes with shoulder pain and headaches. Can give you a lot of headache. Usually one side hurts more than the other. Okay? Often caused by lower segment of the cervical spine. The cervical spine, if we look at it in here, see, this is the cervical spine right over here. Okay? And the most aching area, the most problematic area of the cervical spine is the lower ones. Like you can count, you see it is counting C3, C4. So we can say C4, C5, C6, C7. You see? See those? Those 3, 4 vertebrae right over here. Those are the most problematic region that gives the pain and radiate to both shoulders, upper back. Okay? And shoulders. Right over here. So it's usually caused by the lower segment of the cervical spine from the 4th, 5th, 6th, and 7th. Okay, right over here and going down. Neck pain treatment. Soft cervical collar at the onset of pain. If you have a neck pain severe but is not accompanied with fever, please be careful. Neck pain, usually you wake up during the summertime or wintertime with a neck pain, but you have no fever, but just a difficulty of moving it. It helps to put a soft cervical collar for you to just, you know, it's psychological support actually, to support you, because you're gonna have to move it at the end. Okay? A lot of people who do like this, who sit in the computer like that looking at, you know, browsing the internet. So what they're doing? What they're doing is they contracting the muscles in the back and they overstretching that. And how to correct this is very important. Just put your thumb like this, put it right over here, chin, and do like that. Whether you breathe or not doesn't matter in here. And you feel the tension in the back. You feel it. You will know right away. If you're doing the right thing, you feel something in there, in the back. You will know right away that you're doing the same thing. It's like this. You need to put gentle heat. Heat is very good for the neck. Exercise to stabilize the shoulders. Okay? So you need to stabilize your shoulder, to stabilize your hand. It's just like that. Let me show you. You're coming in like this. Let's say this side is aching me. I put it like that. I sit on it. I stabilize my shoulder. And then I do like this. And then I turn. And then I bend forward. It's painful. It's painful. It's painful a lot. But it will help you out. And it will show you this is not something severe. Okay? Traction the neck with the heating pad and a towel. When you get the towel, you put it behind your neck. And then you do like this. And it's heat. You do like that. It's just you're giving a heat and you're relaxing all that. Use a soft pillow at nighttime. Soft pillow. It doesn't matter how much is the pillow, but it's the pillow that serves the purpose. The pillow that keeps your head and your shoulder at the same level. When you lay on your side, you have the pillow, your ear, your shoulder, and the hip and the ankle is all aligned in one side. That's what I learned from nursing discipline, believe it or not. And not to be on the bony prominences, is off a little bit. That's how you know that you are positioned in the middle of the bed. Neck pain medication, over-the-counter creams or gels, such as a Biofreeze, Bengay, whatever you feel. Please do not apply Biofreeze or Bengay before heat, only after heat. If you want to use heat, you have to clean up the whole area with warm water or just water. Clean it up very well and then leave it for a little while, then you use heat. Because both of them will cause a burn. Please. Tylenol and Advil is the same thing. That's a painkilling. Use prescription pain medication only short term. I mean, usually the doctor will give it for 10 days, a trial. They will give you a trial, you know, to give you a boost, so you try to take care of yourself, to take, you know, to do those exercises so you can finish up with the pain.